Hello, my name is Brandy Holloway, and I am in the Family Nurse Practitioner Program at Auburn University. And today I'm going to be talking to y'all about onychomycosis, which is also known as nail fungus. All right, so onychomycosis is a fungal infection of the toenails or the fingernails. The causative fungi include dermatophytes, yeast, and non-dermatophyte molds. So some clinical manifestations would be like nail discolorations, subungual hyperkeratosis, onycholysis, splitting of the nail plate, and then nail plate destruction. So some risk factors for this disease is dermatologic diseases such as tinea pedis, which is more commonly known as athlete's feet, psoriasis, and then hyperhidrosis. Comorbidities is diabetes, immunosuppression, venous insufficiency, malignancy, peripheral artery disease, obesity, and irritable bowel disease. Some potential exposures are like trauma, poor nail grooming, sports and fitness activities, occupation, smoking, and occlusive shoes. And just some other risk factors is advancing age, contact with infected household members, genetic predisposition, hallux valgus, and asymmetric gait nail unit syndrome. So the three key questions that you would want to address with your patient that was presenting that you thought this might be what was going on with them would first of all be duration and course of nail changes. And the reason why you want to ask that is because with onychomycosis, it's usually acquired and it's slowly progressive nail dystrophy. And the first symptoms that they're usually going to notice is going to be like a white or yellow spot under the tip of the nail. And that would kind of help you differentiate from some other diagnoses that you might be going through your mind. You also want to ask them if there's any systemic disease or history of skin disorders. Some systemic diseases, that might predispose them to this would be diabetes, immunosuppression, and then venous insufficiency. And then, of course, you want to ask them about their occupation, their hobbies, their nail care habits. So if they've had any trauma, if they've got any poor nail grooming habits, or, are they active in any kind of sports or fitness activities? All right, so for physical exam findings, you're going to notice there's going to be a change in the color. The nail color may be white, yellow, it may even be brown. You may also notice some like cloudy or chalky spots on the nail. The nail is usually going to be thick. It may have like cracks or breaks in it, and there may be just one spot or it may be multiple spots that you're going to see this going on. And then, of course, the subungual hyperkeratosis. So for treatment for nail fungus, the options could be topical, systemic, antifungal drugs. You could do laser treatment, photodynamic therapy, and surgery. So some oral antifungals that are commonly used is the griseofulvin, terbinafine, itraconazole, and ketoconazole. And then there are topical agents as well, and that's cyclopyroxalamine, 8%, and then the efinaconazole, 10%. And of course, with the treatment, you want to let your patients know that it may take months for their nails to look what they would call normal again. And there's always the chance that the fungal infection may reoccur. So they may have to, go through treatment again. And so as far as education for the patient, you want to let them know that fungi are going to grow in warm, wet environments. So it's important to keep their feet clean and dry. They want to make sure they're using appropriate footwear, especially like if they're in a communal bathing facility or health clubs. So like if they're using community showers, then, they're going to want to wear their flip-flops in the showers. And then they're at a fitness club or a health club, make sure they're wearing appropriate footwear to try to prevent the spread of the fungus. They need to avoid sharing nail tools such as toenail clippers or fingernail clippers. And then they also need to know that when they're taking those antifungal tablets, you want to take them with a fatty meal, and that's just to increase the absorption. And also they're going to need to avoid exposure to intense sunlight when they're taking those oral antifungal medications as well, because the increased risk for photosensitivity. And that is it. I hope that that was beneficial for y'all. Thank you for listening.